introduce my good friend, Dr. Paul Song, who's on our National Advisory Board. Also, I work with Paul in Physicians for National Health Program, both the California chapter and the national organization. And Paul has been working lately on speaking to the Biden-Harris concept of the public option as at least one tool that they have for dealing with our national healthcare crisis. So, Paul, your outlook on where we need to go next, and especially with respect to what you think Biden-Harris have in mind. So, thank you for joining us.
Thanks so much, guys, for having me. I'm going to show you some slides in just a few minutes. I apologize for missing last week. Had a little health issue, but it actually turned out the following Monday I tested positive for COVID. So I would just warn you all, I mean, as cautious as my family's been, as cautious as we've been at my employment where we test our employees weekly, you simply cannot control what people do outside of their offices or in their own homes. So I got exposed to somebody who was infected by their fiance. And unfortunately, despite social distancing, this is an insidious disease. So I would really encourage everyone to be even that much more diligent. I think I was 99% careful. And in that one moment where I took my mask off in my own office, exposed myself to this. So fortunately, it looks like I'm on the tail end of mine. But I would encourage, again, you all, that even those of us who believe in science, those of us that are trying to do the right thing, none of us is immune to this. So having said that, I wanted to at least share with you, I was given an opportunity or asked to give a talk at the last American Public Health Association annual meeting, why I felt Medicare for all was better than a public option. So this is really lifted from that. And after we've had a chance to go through this, I'm happy to share this with you so that you can actually review it more at your own leisure. It's about 15 minutes if you would indulge me, but I think it'll give you a good idea of where things are, also the existing challenges. But before that we go into the public option per se, I wanted to just review very, very quickly sort of the problems with the ACA so that we are well versed with that. And as you can see here, this is a hodgepodge of words, but it means different things to different people. Probably the biggest thing for those of us that really want a more fair, humane healthcare system was the removal of the pre-existing condition, the way people were penalized for that. Medicaid expansion was probably certainly, we would have preferred a Medicare for all expansion, but those would be the positive things. But in other ways, you had tax credits, and other sides you had increased taxes. But this is sort of a hodgepodge of what it means to different people. And I also feel like it's like one of those ink blot tests. You see what you think it means the most to you first in this. But just to point out that the Lancet, in the run-up to the Affordable Care Act, which is a highly reputable medical journal, which some of you have probably read, took the highly unusual step of dedicating one issue to the run-up to the Affordable Care Act. And in it, it said the healthcare reform process exposes how corporate influence renders the U.S. government incapable of making policy on the basis of evidence and the public trust. And in reality, what we got was there were 3,300 registered healthcare lobbyists for the 535 members of Congress. They were spending more than $1.2 million a day. Well, more was spent lobbying members of Congress on the Affordable Care Act than was spent on the entire Bush-Kerry election. And as a result, we had no public option. We had no insurance rate or drug price regulation. And if you look over the last several years in terms of what's happened to workers, right, because everyone's trying to defend this employer-sponsored healthcare plan, is that earnings for workers have remained flat or actually have gone down. Inflation has remained relatively flat, but the amount that we're being asked to contribute out of our paycheck towards our employer-sponsored care has gone up as well on the front end. But on the back end, if you do use your employer-sponsored healthcare, you're being asked to contribute more in copays and deductibles. So as a result, we're being asked to contribute more of our salary towards healthcare, but at the same time, we're taking home less take-home pay because wages remain stagnant. And this is the part that I think for those people that continually defend an employer-sponsored healthcare plan, we need to become well-versed so that we can really tell them that this is not working. Thing is, the other part is, if you look at the number of Americans that have reported, and this is prior to the pandemic, who have reported that it was very difficult for them to pay for their monthly health insurance each month, it actually increased from 27% in 2015 to 37% in 2017 when the last survey was done. And then in terms of the number of people who said it's more difficult to pay for their copays and deductibles, that's also increased as well. And as a result, if you look at the number of people with insurance that have delayed seeking care because they cannot afford their copays or deductibles, it's roughly 1 out of 3 people. And if you look also among communities of color, you can see this disproportionately affects communities of color as well. So this whole, corporate democratic notion that we just need to give everyone coverage, we all know that coverage doesn't translate into actual access to care because of the barriers that are created by copays and deductibles, particularly if you have one of these really crappy bronze plans that have a $6,500 to $6,800 a year annual deductible. And then let's not forget, because there was no insurance rate regulation or pharmaceutical drug pricing control, that in 2017, it was reported that 45 million Americans forego one prescription at least because they couldn't afford the cost of their prescriptions, including 1 out of 5 seniors who doesn't routinely fill a prescription because of cost. And this is in spite of the donut hole that they supposedly repaired. This is still a major, major problem because you have not addressed runaway insurance premiums and runaway pharmaceutical pricing. And then the other thing that's important to realize is the idea of these narrow networks. So the thing you'll always hear is you don't want a government-run plan coming between you and your doctor or telling you who to go to. Well, the fact is most of us are in a narrow network, and that's defined as being able to see less than 25% of the doctors in your sort of area that are, quote, in your network. So chances are that we're prohibited from seeing 75% of most of the doctors in our network if you are in one of these narrow network plans. And you can see that this is not only for doctors, but laboratory tests, hospitals, all of those things. And you have to look, and the reason I'm pointing these all out is as we move to a public option, if that's what we're, quote, our incrementalists are trying to do, are they going to address these issues that are very inherent to why people are struggling right now with their healthcare plans? So, this is our current system. We have a very convoluted system. Some of you who may still be getting your employer-sponsored plans, maybe last year you had Aetna, this year you have United Healthcare. Maybe some of you, unfortunately, have lost your jobs and are now either uninsured or going into Medicaid. Maybe some of you turned 65 and now are in Medicare. But when you then go back to your primary care physician, they've got to figure out, am I in your plan? Am I in your network? What's your copay? What's your deductible? And all of that administrative complexity is taking away from actual ability to take care of patients. It's money that's being wasted by doctors' offices as well as hospitals alike. It's amount of time that you've spent on your phone trying to figure out who can you now go see since you now have a new health insurance coverage. And this is that at its core, what is very broken about our system, despite in addition to the immoral for-profit nature. But again, you have to look at this in the context of, would a public option solve this, make this simpler as well? And as a result, if you look at administrative costs up above as a percentage of our healthcare spending compared to the other industrialized nations, it's substantially higher. Hospital administration worldwide, it's roughly 25% of their budget is spent on hospital administration. And a matter of fact, Duke University has 1,600 billing clerks for 957 beds. And again, this is stuff that adds to the bill. So this is part of the reason why they can charge $60 for a Tylenol that costs $1 in the pharmacy, as well as quote the point that they're providing all this uncompensated care. But the biggest cost driver for them is these administrative costs. And again, look at it in the context, would a public option solve these things as well? So as a result, as you all know, we have the least efficient healthcare system of any industrialized nation. On the right is the Bloomberg World Ranking of top hospital or healthcare systems. And you can see the United States is not even ranked in these rankings, as well as look at the life expectancies that are dramatically higher than what we have here in the United States. And again, I'm happy to send you all these slides for a deeper review, but I just wanted to give you a little bit of background before we get into the meat of the differences between public option and Medicare for all. So, this was from a couple weeks ago when we reached the 200,000 threshold. We're now, around 245 or something like that, including, and I'm one of those people, and the count keeps going. But if anything, this really exposed some other inherent fallacies of our healthcare system. You remember during the Democratic primary where now President-elect Biden used Italy as an example of why single payer was terrible. He said, look at the death rate in Italy compared to the United States. He said that now back in March, but now look at the death rate in the United States with its glorious broken healthcare system versus all of these countries that have a universal, and many of them have a single payer healthcare system. Just exposing all of these lies that were perpetuated in the Democratic primary. That was one of the things that you heard. The second thing you heard was Klobuchar say, well, Bernie, we don't want to kick 100 million people off their employer-sponsored healthcare. Well, now at a time when 27 million people, maybe even more, have lost their jobs and their employer-sponsored healthcare. This was a study that came out by the Commonwealth Fund in October that showed, look at the number of people that have lost their employer-sponsored health insurance. The reason it's a little bit less than the number of people that have lost their jobs is some of them have maintained COBRA and some of them have gone into Medicaid. But if you look, it's 7, 8 million. And then if you look at their dependents that have also lost, and this is only till October. So remember, we've had more people lose their jobs since then. But again, this, I would say to Amy Klobuchar, what do you have to say about this? Here's what I would say, that these are the number of people in other countries that lost their job in the first 2 weeks of the pandemic compared to how many people lost their jobs in the United States, right? Lost their health coverage. And again, this just exposes lies on both parties in terms of the state of our healthcare system. And the lies that were used against Bernie, no one's gone back and called these people out for them, but I think we need to and really make it clear how those are unacceptable. So, again, we've always said healthcare is a human right, but it also shouldn't be a job perk, right? And that's at its core what I think this COVID situation has really hammered home. This was in the run-up just recently. They wanted to look at, during this COVID crisis, what is the universal support for a single-payer healthcare system? And the bottom line is it's now almost 70%, 76% have support for a single-payer system, including a majority of independents. And even you would say that 69% of Republicans now report being very supportive of a single-payer plan. So before I get into the next, and I've only got about another 5 minutes to go, Bill, is that, while we're, hopefully this nightmare is coming to an end on January 20th, that in the last several years, the Trump administration has done a lot of things to deliberately undermine the state of our healthcare system, and specifically the Affordable Care Act. Part of that was reimbursing insurers for low-income deductibles and co-pays, removing the individual mandate. All of these have been little cuts that have ultimately caused our Affordable Care Act to become even more fragile. And so in the run-up prior to the Affordable Care Act, to COVID, the uninsured rate was already spiking up, right? It was already getting up to 33.2 million people. So let's not just use COVID as an excuse of why our healthcare system is broken, and understand that with or without a Supreme Court repeal, the ACA has deeply, deeply been hurt, and all of the shortcomings have been further enhanced. So the Affordable Care Act repeal, probably the biggest things that we're worried about is if it's tossed out, is the pre-existing condition protection, the ban on lifetime caps. As a radiation oncologist, I can tell you that one of the things I saw early on in my practice, particularly with patients who had had a 10-year battle with cancer, was they had used up their $1 million cap on their healthcare plans and were really at the mercy of state government, Medicaid, or something to cover their healthcare because they had used their cap. So these are some major things that would have dramatic impact on our patients. And as Alan mentioned, the likelihood that the Supreme Court is probably going to overturn this seems to be less and less. But let's not rest on the likelihood of that. It's just so unpredictable. And then if you look at how this would be among communities of color, again, the ACA repeal would really harm disproportionate communities of color much more than the rest of us. And these are other things that, again, get back to sort of the racist nature and the anger towards the ACA, the idea of these takers, whether it be trying to expand Medicaid in red states or just in general. And so a lot of the opposition, I would argue, to the ACA is not so much libertarian as much as it's deeply racist in the rationale behind this. So let's look at the problems, right? And then as we now try to address what a public option would do. So we have 31 to 33 million uninsured. Currently, the ACA doesn't cover our undocumented brothers and sisters. No insurance rate regulation, no drug pricing controls, narrow networks, high copays and deductibles, administrative waste, overall inefficient system, and a lack of health security with job loss. And these, at its core, are things we know Medicare for All will take care of. But I would argue these are things that the public option do not. And let's kind of show you a little bit now about what's going on there. Just as I showed you, the support for Medicare for All is increasing. The support for public option is actually better than the support for Medicare for All. And this came out in January of 2020. So this was pre-COVID. So I would love to see them repeat this, but at least in January, there was greater support for public option than there was for Medicare for All. So the Biden plan essentially was to create a government-run health insurance option, expand Obamacare tax credits by eliminating an income cap, allowed uninsured and non-Medicaid expansion states to basically be enrolled automatically into the public option. And then there were some ideas of potentially reducing the Medicare age from 65 to 60. I will say this, that and it would be great one day to get either Pramila Jayapal or Dr. Abdul El Sayed, who were both Bernie supporters and appointed by Bernie to work on the commission to try to negotiate the most robust public option. Pramila is actually writing an op-ed to really show what it is. There are some things in it that are better than just the generic public option. They're trying to do away with copays and deductibles for people from low incomes. They're trying to make it much, much more robust than what I think we would expect. Just to say that it is better than what might have been proposed during the original ACA. But let me kind of show you some problems with this already. So the big plans, it would create a government-administered public option. It would still retain Medicare, Medicaid, and all of the employer-sponsored, so the multi-playered complex system. It would enhance premium and cost-sharing subsidies in the ACA market, as well as give even bigger subsidies for people who are looking at the public option. But before we get into a little bit more about that, I want to talk about a little bit about Medicare. And then I'll show you the comparison. So 1965, you have, I'm 2 weeks older than Medicare. You have Lyndon Johnson and Harry Truman there signing it. And this is just to show you, despite the fact of taking care of larger, sicker, older people who have more pre-existing conditions and are on more medications and really more chronic problems, that Medicare is still doing a much more efficient job at controlling costs than the private insurance industry, despite the fact that Medicare cannot negotiate drug or bulk medical supply discounts, but it still has greater patient satisfaction than the private insurance industry. And so when you look at the complicated system on the right versus the simple system that we all know Medicare for All has, it really simplifies it, and it's part of that whole administrative cost savings that really makes the difference. And you know, when Bernie proposed his plan, Fox News and even some moderate Democrats went to town. They said it would cost $32 trillion. And despite the fact that on Fox and Friends, they had a poll, you know, despite the fact that it's going to cost this much, would you still be in favor of it? And 73% of the people in the Fox News poll said yes. But what was really disingenuous about the Fox News poll and many Democrats that slam its cost is that the Mercatus Institute, which is a very conservative think tank, found that it would actually save $2 trillion over 10 years compared to doing nothing. So not only could we increase coverage for everyone, but increase and cover everyone, but it would save $2 trillion compared to doing the status quo. But that was never mentioned on any Fox report, or you'll never hear any corporate Dems say that. They'll just say, well, we can't afford $32 trillion or $40 trillion, which is some number that they throw out. But here's the thing. Biden's proposed public option is going to cost us $700 billion over the next 10 years and make very little dent in terms of the number of uninsured. So the same corporate Dems that are slamming Bernie for saying that the Medicare for All would cost this, despite the fact that that would save $2.1 trillion over 10 years, are now pushing for this plan that would cost $700 billion over the next 10 years. So let's look. You have Medicare, which would cover everyone, whereas the public option still would exclude our undocumented brothers and sisters. Medicare is not tied to employment. Public option really doesn't do anything to eliminate the employer-sponsored coverage. The Medicare eliminates copays and deductibles. Public option may eliminate copays and deductibles for some. You can have any choice of doctor in Medicare, but you have narrow networks in a public option. Medicare for All reduces federal spending while insuring everyone, whereas the public option adds additional cost to a federal budget. We eliminate administrative waste and costs with Medicare, but you still have this administrative complexity with a public option. You just added one more complicated thing to the system. Medicare allows you to negotiate deep discounts in drugs and cost of services. Public option, even though Biden says he wants to try to get drug negotiations down, it doesn't really make the entire system able to negotiate more efficient drug pricing or bulk discounts. So these are really some of the biggest changes. But before we even talk about even getting a public option, I want to say this. It's been now 4 years since I used the term to describe corporate Democrats who are beholden to the private insurance industry and the pharmaceutical industry. I got in a lot of trouble for that, but it's showing more proof. So just to show you that the number of Democrats, as you mentioned, Bill, there were 112 Democrats who ran for re-election who on Medicare for All, and they were all reelected, but we have 130 House Democrats. I think a few of them lost in Orange County, who took money from the private insurance industry who were not backing Medicare for All. And then this came out just about 4 weeks ago. Actually now about 2 months ago, David Sirota wrote an article about the Partnership for America's Healthcare Future, which is a front group of health insurance, pharmaceutical, and hospital lobbying groups that oppose Medicare for All. But that's not good enough for them. They're already vigorously ramping up to oppose the public option. And it's run by a former Hillary Clinton aide and several former Democratic congressional aides who are now trying to undermine the public option. And it said within 24 hours of the launch of the industry's website, new ads, anonymous Democratic congressional sources were telling the Hill that Democrats likely will not bother with the public option fight next year if Biden wins the election. And this is before we didn't get the blue wave. This was even with the assumption that we were going to take back the Senate. So here you see corporate Dems really showing their true colors. And I'm sorry about the word I used if it offended you, but this is exactly what I was pointing to about the problem, why we're not getting Medicare for all, let alone a public option. So with that, I just conclude by saying, Shirley Chisholm, who was really, I think, everyone's talking about this handover from Shirley Chisholm to Kamala Harris. Shirley Chisholm actually was the first person to hire my mom when she graduated from Columbia Teachers College. She was a mentor to my mom before she ran for Congress herself. Ms. Chisholm ran some preschools in the inner cities of New York City and hired my mom as a teacher, mentored her, and eventually helped my mom become head of Head Start in Newark, New Jersey. And then Ms. Chisholm ran for Congress. But she was truly unbought and unbossed, kind of like Bernie. But she said this in 1972, we have never seen health as right has been conceived as a privilege available only to those who can afford it. This is the real reason the American healthcare system is in such a scandalous state. And unfortunately, it is in more scandalous state today than it was in 1972. And unfortunately, we still have way too many politicians who were bought and bossed instead of being unbought and unbossed like Ms. Chisholm. So I think it's really important for all of us to understand, obviously, Georgia's crucial, but even if we had gotten the Senate majority back, the challenges would be enormous because of the amount of money that's being spent to continue to hold these corporatists in power. And so we have a big, big challenge ahead of us. We do have to take back the Senate, but then we've got to continue to expand the squad. So, I know you have Harley Ruda. So just in California, I'm just going to say the last thing. Harley Ruda, who's in Newport Beach, and then you had Gil Cisneros. They both lost to two people I actually know, and really disappointed, but didn't surprise me. Because if you're going to run as a moderate Republican, then they might as well just go with the real thing. Let's start getting real people in there that are going to fight for things they truly believe in, rather than just trying to straddle their district, right? And I think that's what we need to really focus on. So, sorry to run a little long. Thank you for the time. Happy to send these slides to you, Bill, to share. But thank you very much.
Well, thank you so much, Paul, and you always hit it out of the park as far as I'm concerned. Unfortunately, your talk was longer than what I had planned for, so we won't do Q&A right now unless you can stick around till afterwards. We're under no time constraint whatsoever, but I do want to respect for those who have to leave at the end of the hour. So, now I'd like to bring up our second guest speaker, who I think really nicely kind of would add to what you were talking about, which is the direction that we need to take now based on all that information, all the injustice, all the inequity that you presented here. And, for a lot of us, that was a reminder. For some of us, it's shockingly, eye-opening even. But I know our good friend Randy Shannon. I don't know why, Randy, the name on your Zoom cell says Alan Minsky. So I don't know if you want to rename yourself.
Alan's taking me over.
Who you really are. But it's our thank you so much, Paul, and thank you, Randy Shannon, who's the secretary of our national board for PDA and a terrific lifelong activist for peace and social justice, and especially in his working class part of Western Pennsylvania, who brought home the vote, the Democratic vote for the president and vice president-elect Biden-Harris team. So, Randy, you are muted. You need to unmute, and Tell us what you're thinking about the movement now for Medicare for All and what we need, what you think the focus should be for PDA.
Thanks, Bill and Dr. Paul. I really enjoyed your presentation. It was a mouthful, very informative, and a lot to think about. So, Dr. Bill, what's my time? Is it like 20 minutes? Is that what you set aside?
Yeah, I think that'd be fine. We'll go past the top of the hour. So if you could use that whole 20 minutes, if you need that 20 minutes, that's fine. We like to bring Mike Fox back at the top of the hour. If you want to, split it in two parts, or if you just need a continuous 20 minutes, that's fine too.
Okay. I submitted an article for the PDA blog. So if it's accepted, it'll be up. The title of the article is "The Struggle for Healthcare is Indivisible." So that's kind of the context that I want to talk about. So, I think we should all congratulate ourselves on the tremendous amount of work that we've done over the past several months to get rid of this wannabe fascist government. Even though a lot of the down ballot races didn't turn out as we wanted, we've still, contacted and developed our relationships with thousands of potential activists. So I think that it's time to draw in the net that we cast and build progressive Democrats of America from a jockey that rides a horse to a heavyweight fighter in terms of heft and ability to influence events. And I think that, the way to do that is to build a campaign around Medicare for All. Our chapter of PDA was formed in 2005, and we held the first citizens congressional hearing in the United States in Aliquippa, PA, on HR 676. And we had a congressman who ran for president a couple times from Cleveland, chaired that meeting, and all the proceedings were entered in the congressional record. And the remarkable thing was we had about 250 workers, and the stage was set with 5 Labor Council presidents, and the kickoff was by the International Vice President of the Steelworkers Union. So we've been working on this issue for a really long time, and it's come and gone in waves. But I think that it's important for us to recognize that healthcare is an intimate, personal, material condition of existence, much different than the other issues that we're talking about. Everyone in this country has to confront their healthcare, their access to healthcare, or how to deal with no access to healthcare. And Professor William I. Robinson, University of California at Santa Barbara, is an excellent analyst. And excuse me, he published an article in Truth Out a few years ago called "Sadistic Capitalism: 6 Urgent Matters for Humanity." And when we look at healthcare in the United States, I feel like sadistic capitalism is the most appropriate descriptor for the conditions that we live under in this country. In Sicko, Michael Moore interviewed Tony Benn, who was a famous left-wing leader of the Labor Party. And that clip is on YouTube if you want to take a look at it. But here's what Ben said. It's just an excerpt. "An educated, healthy, and confident nation is harder to govern by the 1%. So Moore goes on to illustrate in several other clips that publicly funded healthcare, not government managed, government funded healthcare, liberated people become activists around all kinds of issues. And you know, we have a whole menu of issues that we need to confront. And we must recognize that a much larger PDA will be more able to do that. And a public that has healthcare access will be much more easily motivated to get involved in these campaigns. I think that, you know, while we're working on Medicare, we still want to talk about global warming, joblessness, immigration, and debt, so that we're associated with a range of issues that we're confronting, but we're focused on healthcare first, because that's what people need first. We need to organize on two levels. We need to look at how to build a real grassroots campaign around Medicare for all, and how to pull together a broad coalition of progressive organizations to support that campaign. So what does it mean to say that the struggle for healthcare is indivisible? We are advocating the most comprehensive and least expensive solution to the crisis of healthcare in the United States. So when we see it as an indivisible issue, it means we don't separate Medicare from all from other healthcare battles. We don't separate it from an individual's struggle for coverage. We don't separate it from unions struggling for healthcare coverage for their employees. We don't separate it from state legislators trying to work in their state to pass a state bill, or from healthcare workers trying to bring a high standard of care to their patients under the present circumstances. Many unions have endorsed Medicare for all, but most union members don't recognize this as a real alternative to battling for healthcare coverage in their contract negotiations with employers. When we see the Medicare for all struggle as indivisible, then we recognize that union workers' struggle for healthcare is part of our campaign. The political enemies of Medicare for all are the Wall Street banks that gain enormous profits from their sadistic system of healthcare for profit. So union workers who are bargaining, giving up wages, striking for healthcare, confront the same enemy to Medicare for all. So any progress on healthcare reduces the flow of capital to Wall Street. Even Biden's, reduction of the Medicare age from 65 to 60 will reduce the flow of capital of profits on healthcare to Wall Street. When workers strike for healthcare benefits, they risk everything in confronting these Wall Street oligarchs. We're confronting the political lackeys with much less risk. But it's a real difference in the risk we're taking. So one of the things that motivated me, and I'm going to put a link up to another blog article, PDA blog article that Tina wrote. Our PDA Steel Valley chapter is organizing solidarity with 500 United Steelworkers on strike to retain their healthcare benefits. NLMK Steel in Farrell, PA is advancing the global drive of sadistic capitalism to reduce healthcare benefits for workers to increase profits. And when you talk about neoliberalism, This is an essential aspect of neoliberal capitalism, is to reduce healthcare to increase profits. So even if the majority of these workers aren't aware of the implications of their confrontation to stop cuts in their healthcare, we are aware that their strike is part of the indivisible struggle for Medicare for all. That's why our chapter is organizing a solidarity action. We're raising funds, we're collecting toothpaste, everything that people on strike, their families need, and donating food, etc. So, PDA's message to workers is Medicare for all will remove health care from the bargaining table and remove healthcare risk from any job. So that's basically my message. And we had a meeting, I don't know, was it last week, the week before last, and we agreed that PDA National will take some action. I'm hoping that we can set up a solidarity fund and be on the lookout for workers who are organized and striking for healthcare benefits. We need to connect with them. And then all these union endorsements for Medicare for all can become an actual force if the members become involved in this work. And I can tell you that, our chapter has members that work at Farrell Steel. And I'm gonna put the link up of an article that Tina wrote about the Farrell strike. I just want to mention one other thing. In Western PA, there are probably 30 different nationality clubs in every town. As people from Europe, former enslaved people from the South migrated into the industrial centers. But during the New Deal, class-conscious workers organized New Deal clubs in just about every mill town in Western PA and Ohio. And these New Deal clubs advocated for the New Deal and pulled people in from all these nationality clubs, and they supported the organizing of steelworkers in the mills. So that's that's the story that I have to tell. We need to look down at the ground and the people there and bring in, a large contingent to swell our ranks. And then we'll have a lot more clout in Washington. Alan will have a lot more clout when he talks to other organizations if we can, wield this force for progressives. All right, I think I'm pretty good. That was like 13 minutes. So, I can take questions or we can discuss either one of the topics.
Wonderful. Thank you. Yeah, if you can stick around, that'd be awesome too. And I just want to point out that I'm so totally with you. I mean, this concept of sadistic capitalism, and not just, like capitalism on steroids, like we all know from, from the Chicago Boys and Friedman and even, Ronald Reagan, and all of that, but just sadistic capitalism. And the fact you're absolutely right on that, that big insurance is big banking and Wall Street. I mean, they're totally tied in, and we need to wrap our heads around that. All of it. We've seen ourselves as being up against the U.S. Chamber of Commerce for a long time, but it's much bigger than that. Even it's about Wall Street and big banking. Absolutely. So, thank you for that perspective as well, and your work there. I think a lot of us got a tremendous education on the geography and geopolitics of Pennsylvania this last couple of weeks. So, you know, those of us who didn't even know there was a Western Pennsylvania or Allegheny County, for that matter, you know, now have some understanding of that. So, so thank you. And I did see the video of Tina, your wife, Tina Shannon's presentation on the streets there. It was fantastic. Maybe you have a link that you could share with us in the chat there. So thank you, Tina. I see you're contributing in the chat too. But I do want to bring up Mike Fox once again for our formal to-dos for the week in PDA, and then we can come back for Q&A. We'll ask folks now if you have questions or comments, if you can raise your hand electronically. Of course, go to the participants tab in Zoom, and then that allows you to raise your hand and puts you in a queue for questions and comments. And we appreciate those questions and comments to be about a minute each, so that will allow our speakers to respond to them and let everyone have their turn at the microphone. So Mike Fox, are you there once again on our to-do list for PDA for the week?
Indeed, Dr. Bell. My number one to do is to stand and applaud for those two presentations. Knock it out of the park, just like I knew they would. Thank you both, brothers. So getting to work. Number one, I got the other job I have is to do a couple of quick thank yous. Thank you, Nurse Judy, for your kind $100 contribution. Thank you, Tim, and thank you, Stephen, for contributing. And we need to bump that up, especially given Randy's presentation. We want to be in solidarity with those workers like nobody's business. So please hit that donation link. If you can match or beat Nurse Judy, thank you, sister. That's wonderful. If not, $5 is a wonderful thing. Let's just make that happen so we can show some serious solidarity with those workers in Pennsylvania. Second big to-do is piling on our phone bank for Georgia. I'll keep it brief. At this point, we're just simply talking to Progressive Democrats of America, activists in Georgia, making sure that they're not only voting, but that they're active, that they're taking responsibility for not only their own vote, but the votes of others as well. It's our job in PDA not to just simply call every voter out there. It's our job, number one, to get our people active. So we are doing that right now as we speak. Email Mike Fox, MikeFox at P like progressive, D like Democrat, America.org. Mike Fox at PDAmerica.org. Our phone bank is cranking while I'm sitting here yapping. I can literally get you in the game as soon as we get off this call. So, and if you'd be so kind, dump into the chat if you're on board, so we can get a little bit of a feeding frenzy going here. And that's a beautiful thing. All right, other to-dos very quickly. Number one, any phone calling that you are up for in order to either motivate Congress people, motivate local officials, or motivate our PDA members. Mike Fox at PDAmerica.org. We need to have the phones on fire here. Other way that you can do outreach to your congressperson. We've been doing the Educate Congress letter drop campaign for years. Once a month, around the third Wednesday of the month, we deliver a letter that includes progressive legislation. No doubt we are concentrated on Medicare for all like nobody's business in those letters. If you want to become an ongoing liaison to your local congressional office, email me at MikeFox at PDAmerica.org, and we'll get you all that you need there. It's not heavy lifting at all. The letter is already ready for you to go. You just need to get it into the hands of your local congressperson, and we'll show you how to do that. Next way that you can have an effect locally is by participating in the local resolutions campaign, where you get your city council or your county commission